that we were going to talk about, and then we can kind of dive right in.
Yeah, definitely, Rebecca. When we first open any Ayurveda Samhita, and the first chapter that is mentioned is dincharya. How should we start our day and how should we finish our day? So in dincharya, the first thing that is mentioned is just wake up and how to start your oral hygiene. The first thing that is mentioned. Okay. So in Ayurveda, again, for oral hygiene, three major things that we have to follow. First is brushing your teeth the Ayurveda way. Second is cleaning your tongue. And third is oil pulling, or that we say Kawaldharan or Gandush Dharan. Now we can discuss it one by one. In Ayurveda, we used to brush our teeth with different kind of stems of different barks of or stems of different trees according to the need of the patient. And usually the commonly available stems that were used of the neem tree. Okay. So the neem tree, why it was chosen? The neem is bitter in taste. It pacifies the Kapha Dosha. And when we sleep and our body is in stagnant state, Kapha Dosha obviously gets aggravated. And in the morning time of the day, Kapha is predominant. So when we wake up and we take that stick, I think you have some material to show.
I do. So I went and grabbed the stick because I have a licorice root. But I think so. What you were saying is we chew on here, and as we chew, then we also release the juices that could be good for our mouth. But like with the neem stick, right? I think neem is also antibacterial too. So it helps. So we're helping to loose things up that have been stagnant and things. So we chew to like about here or so, and then you have the fiber sticking out, which you can use to
brush the teeth. Yes, definitely. Neem is having all the antibacterial effect. So it kills all the bacteria in the mouth. It creates a good hygiene of the mouth. And with the soft bristles that are formed, we can clean our teeth. And that is very much needed. And contradictory to it, the toothpaste that we are having, they're all majorly sweet taste. So it will aggravate the Kapha Dosha. So we need to brush in the way that there should be bitter things in the mouth, and it clear out the tongue, it clear out the mouth. And then that juice, when we engulf it, it's really helpful for our digestion as well, because it will again pacify the Kapha Dosha in the stomach.
Right. Now, if that's too hard for somebody and they can't come by sticks, or, you know, they have a hard time with the taste, right? So there's other options too. This would be the best option. And it's something that I want to actually try more, because I do have a toothpaste that I use, but it's more of an Ayurvedic type of toothpaste. So that's a better option, right? Too. So, and I think they even make a neem toothpaste that might have a little bit of peppermint. So if you're used to, you know, the minty flavor or taste in your mouth because it makes you feel clean, then, you know, certainly use that, but look at, you know, some better options, because so many of the toothpastes out there have a lot of not good stuff in them. Right.
Yeah. So. Definitely. See, even in India, we are not able to follow all the things, but whatever forward steps we can take, we should take, whatever is possible for our lifestyle. So if we are doing brushing with the very high fluoride toothpaste or harmful toothpaste, we should look someone good options. There are many Ayurveda good quality. In Ayurveda also you have to search for the good quality toothpaste that are having the herbs, that are having lesser sugar, and that can cleanse your teeth well. And definitely we have to develop taste for all type of taste. We are very much fond of the sweet taste in all the things. We don't want to eat bitter things or the pungent thing, but for being healthy, we have to develop a taste for them as well. So after brushing your teeth, your all the bacteria has gone, and your Kapha Dosha gets specified. And after that, we need to do the tongue scraping.
So I got the tongue scraper.
Yeah. So you are following Ayurveda very well over there, I know. So what is the need of the tongue scraper? Our tongue is having taste, but at different areas. So during night, again, Kapha Dosha prepare a layer on our tongue. So when we scrape our tongue, all the Kapha Dosha gets cleaned up and our taste buds become active. So if someone is having the problem of anorexia or not feeling good taste, they should start doing the tongue scraping, and it should be a regular activity. So it enhances the tongue's ability to perceive all the tastes. That is very much needed.
Mhm.
And the third part that is needed in Ayurveda for oral hygiene is oil pulling, commonly known as, yeah.
Let's back up again to the tongue scraping, because I want to talk a little bit more about that.
Yes.
Because as a practitioner, that's one of the things that you look at for health too, right? You might have a patient stick out their tongue and to check the coating. So if you have like a large coating every time in the morning on your tongue, like so much, then that's an indication of ama, right? Of toxic buildup. And so I just wanted to share too, it's like where can, you can get these tongue scrapers, and it's best not to have a plastic one, but like stainless steel or copper. Yeah. And then I can show just a little bit like how you use it, but basically you just stick it on your tongue and then you scrape, all the junk will come out and you can wash it out, and then you can do it several times, not too hard, but just to get all of that junk out.
Hardly 2 times it will clean the tongue, 2 to 3 times. Not
unless you got lots of ama.
Yeah, that will clear all the ama dosha, or the toxins that got accumulated on the tongue.
Yeah.
And after doing tongue scraping, we need to do the oil pulling, or what we say in Ayurveda, there are 2 terms, Kawaldharan and Gandush Dharan. So Kawaldharan is a way when we keep oil, we can keep pure coconut oil, we can keep pure sesame oil in our mouth, a warm sesame oil or warm coconut oil. We just have to take 2 teaspoons of oil and keep it in our mouth and just swash in the mouth for some time, hardly for 5 minutes. So that will create a proper oiling of the oral cavity, and it prevents the entrance of many viruses. Kawaldharan also helps to cure all the diseases that are above the neck area. Okay, all your brain-related disorders, ear-related disorders, eye-related disorders. It improves the skin texture also. It's anti-aging also. So this is how Kawaldharan or oil pulling is done. There is another way of doing oil pulling that we say is Gandush Dharan. In Gandush Dharan, we completely fill our mouth where we are not able to move the oil in our mouth. So we have to take larger quantity, keep it in our mouth for as much time as possible. So what is said in the textbook, it is you should keep your mouth filled up till you have tears in your eyes.
Oh.
So if you can keep your mouth full until that time, it will be having best results for your skin, for your hair, for your eyesight, for your ear, for your brain. So that is really beneficial because it nourishes all body parts above the neck.
So Dr. Sonia, how long you can keep in it in full for you? How long?
How long? Gradually, the ability to hold increases.
Okay.
Like,
so how often? So we do the brushing, the tongue scraping, and then the oil pulling. On the oil pulling too. So if we do the 2 different types, right? If you just do the one where you swish wash 5 minutes, and then versus the other type, how would we do that in a week?
It should be done daily.
Each one should be done daily, even the swishing, and then the whole
should be done daily. And whatever is possible for us, like we can do the Kawaldharan types of oil pulling, we can do the Gandush Dharan. Initially, everyone starts with the Kawaldharan where they can swash, because we are not very much comfortable with keeping oil in our mouth.
Yeah.
So for initial few days, you will feel something different. So you can just throw that, you have to just throw that oil after that, and you can just gargle with the normal water. But gradually, you will not feel even to gargle. You will be so comfortable with the oil. And when you're comfortable with the Kawaldharan type of oil pulling, after that, you can go to the Gandush Dharan type, where you have to fill complete mouth with the oil.
Oh, I might have to try that. I haven't tried that yet.
Okay. There are medicated oils as well, but at home, for a simple go, you can take simple coconut oil. It should be edible coconut oil or edible sesame oil.
Yeah, I like using coconut oil. Has good taste too. It's good for my type, and it also has good antibacterial properties too. So Yeah.
Yeah. So
Very good.
these things are maintained.
Very good. I think that's it. Anything else?
No,
oil?
definitely. Many celebrities are very fond of this oil pulling in India. So that's getting popular. But I just want people to know its actual Ayurvedic name also, because many things have changed their names, and whatever is mentioned in text, if we should use those names, the Kawaldharan and the Gandush Dharan.
Okay. Let me try to say it because I don't know. So Kawaldharan
Yeah.
is the first one. Kawaldharan.
Yeah.
And Gandush. Gandush.
Yes. Perfect. Gandush.
Gandush. So Kawaldharan is the oil pulling and the swishing.
Yeah. Kaval is Kawal.
That's good for our subtitles. Kawal.
Wal.
Kaval.
Kaval. Yeah.
That's the swishing. And then the Gandush.
Gandush. Gandush.
Cush. And then the Gandush. Okay.
Yeah.
Very good. Those are good tips. I think oral health is so important. So thank you again, Dr. Sonia, for sharing the Ayurvedic wisdom, and hopefully our viewers can try this themselves and experience better health.
Definitely. Thank you.
Thank you.
Namaste.
It is always strongly recommended that you consult with a personal healthcare provider prior to applying any of the education provided herein. The educational and informational content provided by Reset and Restore and Natria is in no way, shape, or form to take the place of personalized care provided by a personal healthcare provider. Please use the information we provide in conjunction with such professional advice. The content we provide is purely educational in nature about Ayurveda and various wellness topics, and is not meant to diagnose, treat, or prevent any disease. We make no claims or warranties to cure, treat, or prevent any disease or condition.